Dozens of doctors, nurses, along with people living in Lamoille County are worried about the possibility of the birthing center at Copley Hospital closing. The hospital's president says the Board of Trustees is looking into it right now, but are still far from making a decision. ABC 22's Matt Holderman is live now in the studio with more. And the controversy, Matt, really this is causing between leadership and some hospital staffers.
Yeah, Lauren, that's exactly right. More than 60 people, many of whom work at the hospital in Morrisville, signed a letter condemning their leaders for even considering closing the hospital's birthing center. But Copley's president argues those critiques are premature and says they, like many hospitals in Vermont, are going through tough times.
I just think it's sad that some of the language really shuts down the conversation.
Copley Hospital President Joseph Wooden responding to a strongly worded letter Wednesday afternoon signed by a number of the doctors and nurses that work at his hospital. The medical staffers shared this letter with Lamoille County communities, saying people deserve to know that Copley Hospital leadership is discussing the possibility of closing its birthing center. It also contains numerous stern statements, including, quote, eliminating this essential service would be a betrayal of Copley's mission, and it is short-sighted at best and dangerous at worst.
To cry and say that that would constitute moral bankruptcy is really unfortunate because it tends to shut down the conversation, and we're trying to have thoughtful deliberation on an important issue.
Wooden says that while he understands the concern, he feels the hospital is getting grilled over a decision they haven't even made yet. He says their board of trustees is currently conversating over the future of the birthing center and other clinical services after getting recommendations from a state-funded study earlier this fall. That study was the Oliver Wyman Act 167 report, which looked at ways to ensure future sustainability for all Vermont hospitals. And in a lot of cases, they found the cost of sustainability is saving money and cutting services and staff.
Small community hospitals can't be all things for all people, so there at times need to be some tough decisions as to what's best.
Wooden notes that although the hospital's board is considering the study's recommendations, it doesn't necessarily mean they will act on them. He says it ultimately comes down to a combination of what's best for the hospital and for the community.
A decision of this magnitude, which is really quite significant, is really something that the board needs to decide.
And Wooden also told me the board will be making some notable decisions within the next 30 days, but those will not involve the birthing center. He says board members will make sure all decisions that they make feel appropriate. And by the way, if it does end up closing, this wouldn't be the first birthing center in our region to shut down in recent years. Alice Hyde Medical Center in Malone stopped doing non-emergency births in 2022. Reporting live in the studio, Matt Holderman, ABC 22 News.